Hello and welcome, and thank you very much for joining us and JFCS for another edition of Facebook Live. Our program this evening is talking about preventing substance misuse during COVID-19. It's a really stressful time, so hopefully it is a relevant and vital, impactful program for you. This week also marks National Prevention Week, May 11th through the 15th. And National Prevention Week is an opportunity for communities across the country to come together to raise awareness about the importance of substance use prevention and promoting positive mental health and talking about protective factors and basically keeping healthy kids healthy. We have with us great experts today, David Fialko from the Council of Southeastern Pennsylvania, and Maura Hanlon, the Early Intervention Specialist from JFCS, and Deborah Borenstein, Director of Donor and Event Operations from JFCS. So we have lots of questions and topics that we're going to delve into that we find people are very interested in, chock full of a lot of information. And then we will be asking for questions from all of you, and hopefully our experts can answer or inform some of your questions. So with that, I think we're going to jump right in. And David, I think I'm going to begin with you if that's okay. In today's world, especially with social media and kind of all of the hype around glamorizing substance use and all of these things, but what does the research tell us? Or what does research show regarding trends in alcohol and other drug use among adolescents today?
Yeah, so, we have early adolescent, middle adolescent, late adolescent, and then, young adulthood. Really, that late adolescent and young adulthood, it's kind of a blur. They're kind of, up until their mid-20s, we're really into our late adolescent, whether we like to accept that or not, but we call it young adulthood. So really between, that adolescent years, the top three things that we're seeing used amongst that age group are consistently, and historically, alcohol, cannabis, and nicotine products. And when I say nicotine products, historically, when I was in high school in the 80s, that was tobacco. Throughout college in the 90s, it was cigarettes. Now we have a new form of vaping, or what as we call electronic nicotine delivery systems. I tend to not like to call it vaping because that kind of takes the seriousness of it away. It is it is nicotine administration to the bloodstream via an electronic device. And so those are still really the main three things that we're seeing with the trends. And good news is we've seen a consistent reduction across high school age for prescription medication misuse and abuse. However, we have seen an uptick in amongst 8th graders. And, so what is that about? We're not sure. We look at the data, we look at trends, and then we look at things like, family supports. And could it be that, the kids get, the barrage of anti-drug messaging in elementary school, and then by the time they get to middle school, it kind of like gap, and then they get back into it in high school. So it could be something like that, but those are the trends we're seeing. Marijuana by far takes the lead with around 37% of high school age youth reporting past year use. And when we look at, things like daily use, we're around 6.5% for 12th graders, 4.8% for 10th graders, and 1.3% for 8th graders. So yes, there's daily use of cannabis going on in 8th grade. Daily use amongst 12th graders, 6.4% doesn't sound like a lot, but that still should be concerning. In past year, marijuana use amongst high school seniors is around 35%. So we're seeing that cannabis is by far the leader in substances that are misused and abused. The second item would probably come in with hallucinogens or you know, things like LSD and some of the Molly or you know, ecstasy use, which is they're considered hallucinogens. But really, it's alcohol, cannabis, and vaping or electronic nicotine delivery system use. And when we look at 12th graders for nicotine daily use or vaping daily use, we're almost at 12% of high school seniors reporting that they daily use nicotine. That mirrors what the 1980s showed for smoking. And so if you look at really the vaping industry, it kind of is page for page out of the tobacco playbook. You know, what we were experiencing with smokers in high school in the 80s, we had smoking sections in our high school in Northeast New Jersey. You could go out and smoke with your teachers. You know, it was accepted. It wasn't viewed as that big a deal. And the numbers are matching that now. And today's vapors, unfortunately, are tomorrow's smokers because of that nicotine tolerance being built. But really, those are the trends. Alcohol, we've seen a steady decline in use, and then college years hit, and boom, it's all again. It's still the #1 abused substance on college campuses. But among like drug trends, really, you know, what we're looking at are the big three: access, purity, and perceived level of harm. And right now, access has never been easier for cannabis and nicotine. It's very, very easily to access for many different reasons, which I don't have time to go into. And purity, today's cannabis on average, flowering material, 30% THC content. 1980s cannabis, 3.5% THC content.
Wow.
And then the social norms. You know, we looked at cannabis in the 80s as, you probably shouldn't do that. If you do it, you know, good luck with that. It's bad. You know, we had the Reagans just say no. We had a high perceived level of harm of it, so the use was relatively low. Now we have a low perceived level of harm about cannabis, so the use is high. Anytime a perceived level of harm goes low, the use rises. So those are the trends.
That's a great point. So a couple of things I just want to touch on. I heard you say marijuana use is high, a little bit higher because the perception of harm is less.
Absolutely.
And yes. I also heard you say that drinking, and please correct me if I'm wrong, alcohol use has actually gone down.
Amongst high school age, yes.
Yeah. So perhaps though a small victory or something to celebrate.
Well, unfortunately, the very same individual who chooses not to drink is now choosing the lesser of the two evil in their eyes, which is the cannabis product, marijuana, because of the low perceived level of harm. Because, theoretically, there's that sometimes misinformation that you cannot overdose on cannabis. However, we now have individuals, showing to emergency rooms for cannabis overdose, and youth are calling it greening out. It's when your diastolic blood pressure drops to a level that cuts off the oxygen supply to your brain, and you actually fall unconscious and unresponsive.
Wow. That was the third point I was going to say, is just to leave listeners with this: the cannabis today is far more potent and risky than it was years and years ago.
Yes, for flowering material on average, anywhere from 7 to 10 times more potent.
Wow.
So 3.5% THC in the 80s, up to 30% THC today for flowering material. Now, when you get into things such as extracts or hash oils, now you're talking 80 to 90% THC.
Really something for people to be educated about.
Yeah, absolutely.
Thank you.
It should be concerning.
Yeah, thank you. Good. Thank you very much. Maura, let's turn to you. Given our current situation, what are some behaviors or warning signs that parents need to be aware of in regard to alcohol, tobacco, or marijuana use in their adolescence? Can you shed some light on that for us?
Yeah, absolutely. So some of the warning signs are kind of consistent whether we're in this situation or not, if suddenly you notice that your child has lost interest in activities that used to be really important to them, or they've changed who they're friends with, if they're sleeping more than usual, a change in their appetite, if we're seeing erratic mood swings, anger, outbursts, if they're disconnected from you. And it's probably that's magnified right now because we're all together alone in the house. So we're all kind of isolating in a way that we normally wouldn't do. So I think it's important to be really direct and ask questions. Ask your child what's going on. You know, are you still communicating with your friends? Like how, you know your children, know who their friends are, and ask them, like, you haven't been playing, you know, your video game with who's so-and-so, what's going on? Like, how come you're not still interacting with them? And notice their sleep patterns, notice, you know, if they're eating, how much they're eating. We're a little bit of an advantage because alcohol, tobacco, marijuana smell and changes the way we act. And now most of us are together all the time. So you're actually able to see if they're exhibiting these behaviors. And if for some reason you're not, if you're working outside of the house, now they're alone all day in the house, I would just really be checking in. And see, you know, if they're spending money, there's really nothing to spend money on. So you want to pay attention to that. If they're asking you for money, if money starts going missing, that's something obviously to pay attention to. Many people have alcohol in their house, so just pay attention to what's happening with your alcohol. If it's, you know, if the levels are changing and you're not drinking it, you need to check in with that. I just think emotionally, we just want to be checking in with them because they're picking up on our emotions and we're all feeling anxious and kind of untethered right now. And we have to be that force for them that kind of, you know, grounds them. So you want to just have as many conversations, I think, as possible right now about how they're feeling and what they're doing with those feelings. And if they're using, we want to hopefully have created some kind of dialogue with them, an open communication with them, where they feel safe talking to us about it. And if not, then that's when we kind of have to be a detective and look for these signs of change. And I really do think change in behavior is key, like noticing their mood swings and their friendships and how their friendships change and how they're able to communicate with people.
All excellent and really sound guidance on how to stay connected to, especially, and I loved what you said, emotionally connected.
Right.
Our teens and adolescents and even young adults.
Yeah, because that I think is often what leads them to using drugs and alcohol is because they're not feeling confident, not feeling safe, not knowing who they are yet. And so they're looking for something, and we need to be there with them talking about all of that and building those feelings up so they don't need to find that somewhere else.
Really important, great information. Thank you. Thank you for that. David, I'm going to come back to you. Based on the behaviors Maura just talked about that she just discussed with us, can you give us some insight on the reasons for these, like adolescent behaviors? What drives these adolescent behaviors?
Yeah, really, you know, instant gratification seeking behaviors really is what it comes down to. You know, they have a new grasp on these executive functioning areas of the brain that are relatively new to them. It's kind of like putting a new driver into a Ferrari. You know, it's too much too fast. You know, there's a lot of theories with brain development, and we all know that the brain develops from the back of the brain to the front of the brain, the medulla oblongata up to the prefrontal cortex. And you know, there's been a lot of historical conversation that the prefrontal cortex is really underdeveloped during the adolescent years, and really what it comes down to is it's not that far off from being fully developed, but the areas of the brain that communicate together are the ones that are problematic, like the amygdala, where our fear and communicates with our emotional memory. And if you're just a little under in this decision-making part of the brain, you know, that amygdala is going, you know, feel good, no fear, risk-taking. And so when we tell young people not to do something, and, you know, these are the consequences, for many people, it works. You know, if you were my wife and, you know, somebody came in, and my wife was very straight edge, summa cum laude, you know, couldn't do anything wrong. You know, she would listen and she would follow those rules. If you're on the fringe where you're more risk-taking behavior, unfortunately, that brain might get the best of you. So yeah, you know, smoking in the bathroom at home during a pandemic and thinking mom and dad aren't going to catch you just makes perfect sense. But realistically, you know, Maura touched on some really important things, you know, social anxiety. You know, right now, kids are experiencing social anxiety that really no previous generation that is alive has experienced. So I think it's it's a kind of a combination of those things, that instant gratification seeking behavior, that underdeveloped parts of the brain, a new command over executive functionings that make you feel great and good, and then social anxiety.
Yeah, so not just one thing, but maybe a confluence of things or a couple of.
Absolutely, and Maura probably talks to families all the time about the importance of having a conversation. So I don't know, maybe I want to bounce that back to you.
Absolutely. Yeah, I think we don't want to be afraid to ask direct questions, right? Like, you're not their friend, you're their mom and dad, and they have a million friends and they have 2 parents. And so I think sometimes just saying, like, are you drinking? Are you smoking? Are you smoking weed? Like, you need to say directly to them. And we know it's their job to lie to us. Like, as teenagers, it's their job to lie. So we accept that. But if we never ask them, we're sort of co-signing the behavior. We're sort of like saying like we're looking the other way, or we're just accepting it as they're acting out or they're experimenting, or, all of those things, which may be true. But if we don't set the line that it's not acceptable, then we're telling them that it is. And so we have to make that decision that we're going to talk to them directly about it.
That, yeah, wonderfully said. And, unfortunately, that whole, we have, unfortunately, European mindsets like, well, they can taste the alcohol, and may work for some kids, may work for others, may not work for many. We don't know. But I think you said very, set the standard.
Yeah.
Giving parents permission to set the boundaries.
Yeah.
Yeah.
Kim Porter, be part of the conversation. I'm sure everybody's familiar with her. She always be part of the conversation. That's what she started her thing on.
Yeah, and I would suggest that starts when they're young. I mean, very young. Like, you want to be talking to them, not necessarily about drugs and alcohol, but you want to be talking to them openly forever, from the minute you can, about what's going on with them, and know their friends and ask about their friends. And know them and let them feel safe telling you things that they maybe, you're not going to approve of, but they know they can talk to you about it.
Yeah. I heard one time, to your point exactly, prevention is not one 60-minute conversation, it's 60 one-minute conversation.
Right, absolutely.
So you have the opportunity.
Yeah, I love that.
And you bring up another really good point with, feeling safe. And a lot of times when we see young people acting out in school, it has a correlation between not having that safety at home. And I'm not saying abuse or something, but not feeling the ability to have those conversations and feeling safe to have them. So they act out in home. Whereas if they feel safe to have those conversations at home, there's less likelihood.
Absolutely.
So yeah, we're rumble strips, right? We're the things on the side of the highway that keep us in our lane, that keep the kids in the lane.
Absolutely. Yeah.
I think it's back to you, Kiersten.
Okay, great. Thank you. You froze for just a minute there. Maura, I'm going to come to you now. So let's talk about some alternative strategies to alcohol and other drug use. What are some healthy coping skills kids can be utilizing right now? And how can parents model for their children those behaviors to their kids, to their adolescents?
So that's kind of perfect, because that's what we were just talking about. I think like out of the gate, like parents want to provide like structure, security, and attachment, right? We want to get those things like out of, forever. And right now, structure is so important, because there's just really very little, nobody knows what day of the week it is. Nobody, the days are just blending in, and that can really create anxiety, I think, for anybody, and so especially teenagers. So we want to, whether they seem like they like it or not, we want to be creating structure in their day for them. We want to be encouraging them to, as we know, exercise, right? We want to have endorphins, we know that. If it's safe to wear a mask and do the distancing, be outside, especially as the weather gets nicer. Like, we want fresh air, we want to be able to, experience that. Things that I think every kid I talk to is listening to music, making music, those things, are, talking to their friends, make sure that they're still checking in with all their friends, they're still doing things that fill them up, so they're not feeling alone. Things that we can model is just like, how do they see us coping? If are we are we exercising every day? Are we eating nutritionally? Are we doing yoga or meditation or walking or, you know, whatever it is that is a way that we decompress? It's not drugs and alcohol. You know, what are other ways that we decompress that they see us doing? And then I think it can be a really nice time to do stuff together again, like play board games, or, you know, my son and I love to play cards, or just, you know, things that you didn't used to have time to do together, now make time for it. And I think sometimes it seems like teenagers especially are pushing us away, but they do want us. They do want to be around us. So watch a movie together, or make a meal together, you know, show them ways to enjoy themselves and have fun and laugh and relax and all of those things that they could be getting from drugs and alcohol. Let's do that, you know, organically. Let's do that naturally and together in ways that are fun. And I think they're real. I mean, I think they see us having fun without drinking, then they know you can have fun without drinking, for sure.
I've seen study after study that says through early childhood, middle, late adolescence, and even early adulthood through the college years, it is the parent's voice that holds the most weight when it comes to decisions around substance use.
Yeah.
Exactly.
Right. I mean, the parents kind of set the tone for your values, which is different than what your peers do.
Exactly.
Yeah.
Good. Great information. Thank you. And then David, finally, what resources or types of resources are available to parents who have needs or concerns around these issues?
Yeah, so, you know, when we look at resources, we should all be very thankful that we live in an area that's rich in resources. You know, in Philadelphia County, the Cap for Kids websites are a great resource. You know, we're going to kind of breeze through these for time wise, but I'm sure that if the viewers have any questions, they can contact your office or my office or whichever they deem they feel more comfortable doing. There's a Cap for Kids website for mental health and behavioral health, and then there's a Cap for Kids for substance use and drug and alcohol. And they both have wonderful resources for everything, you know, for all ages and supports. And then you have the Behavioral Health System Initiative, which is a city-funded agency for individuals without health insurance, to where they can get you know, services for themselves and family. Their phone number is listed down there, as well as their website. Philadelphia Community Behavioral Health is another office which has an incredible amount of resources and people who are so passionate about keeping their communities healthy. And of course, then there's you know, Jewish Family Services. So, you know, you guys do an amazing job down there. Put your number down there. And for Montgomery County, there's the Montgomery County Office of Drug and Alcohol, the Department of Health and Human Services. Both have very broad amount of resources available on their websites. And I believe they are still accessible by phone. But some family supports, these are just, you know, some resources that most counties have, but Montgomery County is really great on having a broad selection. Al-Anon, which is for family members who may be experiencing alcoholism in their family. Be part of the conversation. I'm a big Kim Porter fan, so if anybody knows her, look out for her. You know, her webinars and her resources. She brings in some great speakers from across the country. Because I Love You, Grief Response After Substance Abuse, Passing, those are for family members or children who may have lost an adult or a loved one due to an overdose. Yeah, they have to get that processed. So there's lots of different resources out there. I could spend an hour just talking about this stuff, but I've got like a minute. You know, then there's intervention services, like individuals like Maura, who, you know, provide these services for families and individuals, but these are some other ones here in Montgomery County. And then again, JFCS. And in Bucks County, we have the Bucks County Drug and Alcohol Commission. It's kind of a one-stop shop. They just revamped their website last year, and it's amazing. It's very easy to navigate, and it has just a ton of great information on it. There's our office, which is funded by Bucks County Drug and Alcohol Commission. We're thrilled to have them support our efforts. And you can check out our website, which has something called the PROACT Family Program, Family Ed Program, which helps educate families on substance use, abuse, misuse. And then there's also a children's crisis support program, and that's accessservices.org, another great resource for Bucks County. And in PA, again, that PROACT Family Ed program, as well as a hotline for the southeastern PA region there. And then, of course, if you get on to things like CDC or the Department of Health, there's lots of great resources there. So I want to be respectful of the time. So
Thank you. Great. Thank you
hand it
very
back
much
to
for
you.
that. Perfect. Thank you. Deborah, I want to turn to you for a moment. I know I just want to be mindful of the time. Are there questions that have come in?
There are questions.
Okay, great.
And there's some really good ones.
Okay.
The first one is, my son had social anxiety before the pandemic, and I'm afraid it's exacerbated now, and that smoking marijuana helps numb that anxiety. What should I do?
Absolutely. I guess she's not gonna be able to answer questions because I'm wondering if she means that he is currently using that, or she should use that. So there are some ways that you could quell anxiety, like grounding techniques, breathing exercises that you could do as the anxiety starts to ramp up. If you can drop into your breath and practice some breathing exercises, it'll bring it down. Grounding exercises are really good for anxiety. Trying to think, exercise you want to be doing, to get your body tired.
But as a parent, how should the parent interact when you know it's happening? Because, you just know that your kid that's how they're handling their anxiety, because this is just such a unprecedented time.
I would never recommend marijuana as the way to go. And I know that that's hard. It's really hard, especially right now, because these are really unprecedented times, and you want your child to be able to decompress. And if that's what's working right now, while we're all kind of doing things differently, I would look into other ways, though, even medically, other ways that you could deal with anxiety that's easier to navigate than marijuana, because there's no regulation on marijuana. You don't really know what you're getting. Whereas if you were to take an anti-anxiety medicine, you would know what you were getting, and that should be paired with therapy. I mean, that's really the ideal way to treat anxiety, is medication paired with therapy. If that's an option to do right now. I know it's probably telepsych, which is the problem, but.
And there's a lot of, even though cannabis is listed in the medical, on the Department of Health's website as anxiety is one of the 23 disorders that justifies use of cannabis products for 18 and older medicinal use. All of the research points to it being counterproductive for anxiety disorders. And the main reason is because it raises the dopamine levels to such a level that when it returns to normal, you're actually below baseline, and thus putting yourself into essentially a protracted withdrawal or anxiety-inducing state. So unless the person is actually using the substance, they're going to feel more anxious than if they never used it at all. So as Maura said, you have to address the underlying cause of the anxiety and treat it with close medical supervision. Self-medication of cannabis is just a horrible idea, especially for the developing brain, which is highly sensitive to looking to use it again and again.
Right. It's very hard. Another question that we got is, what if my child comes to me and say they tried marijuana or even another substance? What are some talking points?
I would ask the situation, what they were feeling before they used it. Like, were they feeling peer pressure? Were they feeling like everybody looked like they were loving it and it looked like a great time and they wanted to try it? I would ask them how they felt after they did it. And I would be really clear that I was happy that they talked to me about it. I wouldn't push back and be judgmental. I wouldn't, put any kind of fear into them. And I think that's kind of tricky because everybody has different rules about how hard you want to come down on that, but how amazing if they came to you and said, I've tried it. So I would try and keep the conversation open and not come back, hard. And I would find out, if they felt like it was something they wanted to do, and something that I have always talked to my own kids and other kids about is what David talked about, is your brain and what it actually really is doing to your brain, and what all the research says about up to 25, what your brain looks like. Realistically, I don't know how much kids take that seriously because it doesn't seem real to them, but you do want them to have that information, that there is a ton of research that it's detrimental to their brain development prior to 25.
And that almost, that I guess I will tie into a little to this next question that we received, which is, you know, right now, and we talked about this earlier, that, you know, older teenagers and younger 20 somethings are feeling that there's not a difference between alcohol and marijuana. Marijuana is becoming legal in a lot of states. So what are the things that you can say, or how do you steer them away from this choice that marijuana is the way to go if you need some substance in the moment?
So that's twofold for me. I think, well, I think we want to find out why they need a substance or why they want a substance. That's always the beginning question for me. Like, do you feel like you're not going to have fun if you don't do it? Do you feel like you're not going to be able to interact with, you know, be flirtatious or be friendly? Or like, do you need that as a social lubricant? Like, what is the reason that you're associating with using drugs or alcohol? And then find all that out. And I would talk to them about that, because if the only way that you know how to feel good about yourself or feel comfortable in your own skin is by using a substance, that's really limiting. And if that's what you learn at a young age, how do you ever unlearn that? You know, if you start that at 15, at 30, that's it. That's the only way you know how to go out and dance and have fun and talk, you know, you're limiting yourself. So I would start with that. And it is tricky because it's likely that marijuana is going to be legal everywhere, and it's certainly legal in many places. So I think that's going to come down to, and David, you can certainly chime in here, it's going to come down to how you want to explain to them what it does to your body. And let's be honest, they both do bad things to your body. Americans are just more accepting of alcohol, but both substances do bad things. So I think you want to just give them all the information about what marijuana does to your brain, what the addictive qualities are, because that's, I think, the favorite thing that they like to say. It's not addictive, but there's a lot of research that says it is. And try and give them information. If it's going to be legal and they're over 21, then those substances are going to be available to them.
Yeah.
I wasn't sure if you were going to say anything else. I have one last question.
I think Maura said it perfectly. Yeah.
Right on. The last question I have is, a parent is expressing that their child is worried about a friend who has started using during this time. And, you know, with social distancing, it's very difficult to act on a worry like that or a concern like that. So what is your recommendation on how to speak to my child about the friend and what my child can do for their friend? So it's kind of twofold.
So I always want to start with the affirmation, right? Like, that's amazing that you've come to me to talk to me about this. You must really care about your friend. I'm worried about that behavior too. Let's talk about why you think they're doing it, you know, and they're probably going to say all the things that we've kind of talked about today, right? That they have this like free floating anxiety that they're trying to quell, and this seems to be working, or they're bored. Even, you know, gosh, that's a reason to use too. So I would find out, as open as they're willing to be, about how often the friend is using, what they're using, because we talked about a few things on here, but there are much scarier drugs that their friends could be using that you want to talk to them about. And then I always, but it's probably because of my job, but I always offer to talk to the friend, like, would they be comfortable talking to me about it? Is it something that I could maybe help them as an adult that maybe they know? And perhaps that's something that the person that asked the question is comfortable doing. And then you get into like, can we talk to their parent about it? Which is probably when her child's gonna be like, no, we're definitely not gonna get their friend in trouble. But I would say anytime a teen is talking about another teen, there's a reason to be concerned, because they're able to recognize, I think, what their friend is really doing, and they're probably less likely to be concerned than an adult. So if they're sensing something to be concerned about, there probably is something to be concerned about.
And if it's, you know, if it's a school, you know, situation, you know, there's always resources available that kind of take the weight off of you, such as student assistant program. You know, your child can always refer them to, you know, the student assistant program in school. in college campuses, there's, the student, life, aspect and student health, to where you can confidentially and anonymously, report, hey, I have a concern for this person, and a counselor will get a hold of them, and, have a talk. And if that destroys that relationship, unfortunately, with that friend, unfortunately, it'd probably be better to have a friend who you may not interact with, who is still alive, rather than a dead friend and regret, or a friend who moves on to harder and more serious drugs and a life, challenges that are going to take years to resolve, rather than something that can be dealt with up front. So if it's early cannabis experimentation and a friend is seeing that spiral into, abuse and dependency, and is on, that addiction mindset, that's having a conversation with them, and have a plan too, have a plan. If you're going to, intervene, surround yourself with people who are trained to help you.
Right. And I love what you said about peer support. I didn't even think about that, but you're right. There's definitely, many schools have peer support in place, and that would be an option also.
Absolutely.
I don't think we have, I think that was the last question.
Awesome.
Excellent. Thank you. Thank you so much. Well, I hope the program was impactful and informative and all that we hoped it would be. It will be up on the JFCS website. And I'd like to thank David Fialko, Certified Prevention Specialist with the Council of Southeastern Pennsylvania, Maura Hanlon, Early Intervention Specialist with JFCS, and Deborah Bornstein, Director of Donor and Event Operations at JFCS. I'm Kiersten Simon. Thank you very much, and everybody stay safe.
Thank you so much.
Thank you very much.
I'm just going to put our real quick, just before we sign off, let me just share our contact information. If anybody
Wonderful.
needs to reach out to JFCS, there's our phone number and there's our link for COVID resources. And then you could also find our prevention services information on our website. Let's do that. Kiersten, I wanted to say thank you so much. You've been an incredible moderator, and I feel very lucky and blessed that you were here to join us this evening.
That was wonderful.
Yes, thank you, Kiersten.
Great.
Okay. Thanks very much.
Thank you.
Okay, take care. Stay safe.
Yep.
Take care.